Oh, and Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is all four wisdom teeth, starting with the lower right wisdom tooth, as you can very clearly see. This is the transaxial view or the proximal view. As we move posteriorly, you will be able to notice. As you move proximally, you can see this is a horizontally impacted tooth, and at the apical one third, we come in very close approximation to the inferior alveolar nerve. The mesial root comes in contact and compresses the inferior alveolar nerve, and the apex definitely compresses the inferior alveolar nerve canal. So this tooth is in very intimate contact with the inferior alveolar nerve. This is the upper right. Now we're going to focus on the upper right wisdom tooth. The upper right wisdom tooth is distoangular impaction. Now this is the 7. As we move towards the 8, as you can see, the roots are going to start appearing. As you can see, this is where the roots of the upper right 8 start to appear. They're palatally in place. They're not fused to the upper right 7, but this is where they are palatally in place. There are 3 roots and they're distoangular impacted. Now, to get a better view of this situation, you will get a very good idea. We look at the axial view or the top to bottom view. So this is how you can see. This is the upper right side. This is, as you can very clearly see, distoangular impaction, and you can also that the roots are very positioned palatally, but at no point is this tooth fused to the upper right 7. Now we're going to focus on the lower left 8. The lower left 8, as you can see right here, is very also horizontally impacted. The at mid root level, we're approximately 1 millimeter away from the nerve, and at the apical one third, the mesial root comes in very close contact to the inferior alveolar nerve canal, as you can see right here, and it is very closely associated with the canal right at this point. So this is how the lower right 8 is. Now moving to the the lower left 8. The upper left 8. This is the upper left 8. The upper left 8 definitely has a crack or a cavity, which you can see right here. It's not as angulated as the upper right 8, and the roots are very much fused and not as widespread. You can see very clearly on this transaxial view. When we move towards the axial view, this is the upper left 8, and you can see the roots are quite fused and not as widespread. It's much more straighter than the upper right 8, but definitely is also distoangular impacted. This is the axial view of the lowers. You can very clearly see the association between the inferior alveolar nerve and the wisdom teeth on the axial view as well. There we go. Very close and intimate contact. So the extraction, the right side is more complicated than the left, but they're definitely very closely associated. So their extraction should be done in extreme caution. Thank you very much.